So I am requesting Farah, please you introduce
Yes.
Professor.
Okay. Good evening, everyone. Good evening, Rita ma'am.
Good evening.
Let me share my screen. Okay, students, let me introduce you with Rita ma'am. So, Dr. Rita is a PhD in applied psychology from Indian Statistical Institute, Kolkata, with junior and senior research fellowship. She worked at Indian Institute of Management, Calcutta in behavioral science group and worked as senior business analyst at R&D of Cognizant Technology Solutions. Presently, she is associated with the Department of Applied Psychology at Amity University, Kolkata as an associate professor. She has more than 12 years experience in teaching psychology, behavioral science and organizational behavior in UG, PG and PhD course workplaces. Published 35 plus papers, served as resource person in conferences, and holds a 2019 patent recognized with awards including Best Paper 2014, Merit Award 2015, Women Researcher Award 2018, and Outstanding Presentation Award 2023. She has taken class on case study and phenomenology in 1 month online certificate training course of qualitative research methodology in June 2023, organized by RPRIT. Okay, so ma'am, we want to express our heartfelt appreciation for your outstanding achievement. It is worth mentioning that all the students in this course come from a psychology background. They are all postgraduates, and many of them are also in the teaching profession. Your extensive experience and knowledge in the field of psychology will undoubtedly serve as a guiding light for these students. This diverse group of students brings a wealth of knowledge and experience to your class. Ma'am, please take over from here.
Thank you, Farah ma'am. Thank you very much for your kind words, and I'm indeed grateful to the founder of the organization, our very own Dattarai sir, and my professor. So thank you very much, sir. It is my, it would be a learning experience for me that you have given a chance to share some of my views in the field of research, experimental design, or sampling, and basically the field of research. So thank you very much. And it's, it's really a great, wonderful experience to be a part of such a learned participants. And I would rather, feel that this experience would be this discussion would be very interactive rather than I will say many things. I think participants will also kind of participate and discuss and throw some light on their understanding as well, so that I can also learn from them. Thank you very much to all of you, and very good evening to all of you. And also it's a belated happy Teachers Day to sir and other teachers and all the participants who are here. Pranam, sir. Okay, so with this, let me just share my screen. Give me just a minute. Let me share my screen.
Farah, you please knock other students.
Yes, sir.
Okay, so yeah, so can we begin, or do we need to wait, sir?
No, you can continue. I think that is better.
Okay.
Because YouTube is available, people will take note from there.
Okay. Okay. Thank you, sir. Yes. So the today's topic of discussion is experimental method and different experimental designs as well. So basically, when we do any kind of research work, the design that we need to follow is going to be a kind of blueprint of any kind of research work. So if that design goes wrong, then this entire research will be will not be following the right path, obviously, because this is a blueprint. So we need to be very, very careful, and while choosing the right research method as well, research design. So with this, let us just begin that very simple thing. I will just begin with very simple thing, that what is research. But I know that all of you know this thing. So if you can help me in enriching the definition that has been given. However, I have given a very short definition of research. So as we know that I will also come to all of you because as I said, it is going to be very interactive, so that we can learn from each other. And like the word research, that actually tells what it means. Research means researching something, right? So it is a kind of process of steps to be used in order to collect, analyze information, to add some value to our understanding of a particular topic or an issue. It could be anything. So it is, in short, even it is one liner definition is that, or maybe one word definition is that it is researching. So we are researching something, any kind of information or a topic, and we are adding some more values to that topic or an information by collecting certain kind of data or response. Now it could be primary data, it could be secondary data as well, but mainly in social science, we do collect mainly the primary data. So which is very important, because like when you are collecting primary data, you are interacting with your subject or the sample, and then or your participants. So it is very much important to get their viewpoint and the first-hand information from them. So this is my understanding of research work, a research definition of a research. So if I would rather request few of you, if you throw some light on your, the research, the topic, or maybe the what do you mean by a research? So anything you can say, the definition of a research in your own words, or maybe a kind of research that you have undertaken. So maybe in brief. So if you just kindly highlight, it's over to you all. Anyone would like to share something?
It is a systematic study of a problem or an issue at hand. And we use some empirical or existing knowledge to study it further. We could be exploring a phenomena, or we could be explaining a phenomena.
Right.
Yes, ma'am. I mean, I think.
Yes, yes. A good definition. Anyone would like to, like give some examples of that, or maybe if you can also give some example of what you say. You are completely right, but like to make it a more understandable, if we can give certain example of what we want to say. Yeah, over to you. Yes.
Hello, Shukshiddi, Varsha, please you tell your research problem.
Yes.
so that it will be clarified by Madam.
Anyone? I mean, am I audible to all of you?
Yes, ma'am.
Yes, yes. Tell me if you have any, I know, like understand. Definitely, you all have the understanding. You all are a postgraduate or PhD students or scholar, so you definitely have certain understanding. So I want to learn from you all. If you say something on this, or what do you mean by your research work? What is your, understanding of that? If you say something.
Mona Lisa has written chat box.
Yes, just 1 minute, sir. Somehow this, 1 minute, some of my screen is, I'm not able to see properly. 1 minute, there is some problem.
Ma'am, can I tell you?
Yes, yes, please, ma'am.
Yes, ma'am. So she's writing that the term research comprises two words, and search. Re means
Right.
again, and search means to find out.
Right. And again, is my screen visible to all of you?
Yes, ma'am.
Okay. Actually, there are some problem happened. I thought that if not screen is not visible. Okay. So
Madam,
let me if let me check what is there in chat box. Yeah. So Mona Lisa ma'am has written the term research comprises two words. Yeah. So that's what exactly said. Right, ma'am. Thank you very much. If somebody, so now by now the meaning of research is I guess it is clear. It was clear. It is also clearer right now. So if somebody, as sir said, that if someone wants to say something with an example, if anyone would like to speak on that.
Ma'am, suppose actually research means we have got a problem and we want to find a solution to that thing.
Right.
That is why we go in depth of that thing. We research those things and we come out of the come with a solution to that.
Right. No, can you give some, Varsha ma'am was talking, right?
Yes, ma'am. Yes, ma'am.
Yeah. So, ma'am, if you just give an example, the research that you have undertaken. So, we are not here to, correct anything, but I just wanted to know that, what are the basic things of research with an example, if we can understand. Because if we do not understand research very clearly, then the research design would be very difficult for us to to formulate or to identify whether this is the correct research design or not. So if you can give some example, you might have, taken certain research work. Yeah.
Specific to experimental method, do you want an example or any other?
No method is required. I'm asking any kind of example of a research that you have undertaken.
Not suppose in an education field.
Anything, not an issue.
There's an example. Suppose it is an education field. We have taken we gave a test. Let's say mathematics test was given, and scores was obtained. So when we saw the scores, the marks were not so very good. So the problem was there, why the students have not scored well in the mathematics exam.
Right.
That was the problem which was identified.
Right. So that means why do we do research? Very important point you have highlighted. That is, why do we do research? It starts with certain problem, right? Certain query. Rather, better than problem, the better word would be query. So as ma'am already said, Varsha ma'am, right? Varsha
Yes,
ma'am,
ma'am.
you're speaking, right? Okay.
Yes.
So Varsha ma'am has said that that problem that we want to clarify, or the query that we want to look into. So that is the kind of the first step of research, right? Anything you want to add, or somebody else would like to take over from here? Anything else? What
Ma'am,
will happen if yeah, yes,
ma'am, basically, this was the problem which I have observed.
right,
So now I will explore why this has happened in my class.
right,
There could be many reasons behind that. So maybe I'll start with one or two. Let me say that maybe my teaching was not good.
Hmm.
So the student has not performed. Second,
Right,
second possibility which I might think will be maybe the students are not very good in studies. These are the two things which I will begin my study with.
right,
Maybe when I start studying, I might discover many more things also which are involved here, which I had not thought of. That is how I will discover many outlets which has been performing their means collectively contributing towards a poor performance. Then
right,
this would open space for working on all those individual segments individually, so that I could give them more support on those fields. Like I began with 2 points only thinking, means my hypothesis would be with 2 things which I thought of, but as I studied, I discovered many more things, so that opened more avenues for new researches to be done, so that the performance could be enhanced further.
right, right.
This
Any,
much.
yeah, okay, very good. Thank you very much. But then you talked about this hypothesis. So here in this particular session, we will not going into the detail of the hypothesis, which is also very, very important, stage or step of a research formulation of hypothesis, how to do it. Okay, so but then we'll not go into the detail because this is on experimental design, right? So now, like ma'am, when you say that you have identified the problem, the next step also, I think you must have reviewed certain literature in the existing literature in that particular, which are there in that particular, related to that particular research problem. Am I making sense? Okay, so yes, anybody can give some example on this review of literature, the example, just an example. I don't want to hear any review what you have done, but then just an example that why it is needed.
What is the available literature which is available in terms of your research problem? How many studies which has already been there, which is evidence-based in nature, which can be tabulated in terms of ROL, review of literature?
Correct. Very good. Thank you. So then once you have reviewed the literature, study something, I'm also looking into something which is not in studied, and I have to research the particular area, suppose the academic performance, but then I have to research and find out certain things which are not being studied. Am I making sense? This is what this is how we develop certain objectives or formulate certain objectives in the research work. Am I making sense?
Yes, ma'am.
Okay. So now we'll have certain objectives, right? And then from this literature gap, means we are going to formulate certain objectives as well as certain hypotheses. Like what would be the tentative statement stating the variables that I have undertaken in my study? Is this what we do?
Yes, ma'am.
Okay, so now while we are doing, and then the next step is the collecting data, but there is something in between this, because like when we start collecting data, we have to know that collecting data is that either it could be a primary or a secondary data, but then how will I collect data? Okay, what is the what is the framework I need to follow while collecting data? That is very important, and that is all about the research design. Is it so what as per your understanding?
Yes, ma'am.
Okay, so then I will then after collecting data, now next part we know that we also need to know that if this is the design, what would be the sampling of that particular research work, right? So it could be parametric, non-parametric sampling. So the sampling part will come later on in the other sessions, right? And then when following a certain sampling method, when we collect certain data, and we also kind of either we try to develop our own questionnaire scales, or we use some certain standardized scales, right? And then we collect data with the help of that. It could be standard some interviews as well. So for mainly for qualitative research, as like sir has conducted already one course on qualitative research, so there we discuss this in a qualitative research, what we basically do. So in that case, we collect data using certain interviews or maybe some other sources, and it could be some standardized questionnaire, etc., etc. And we collect data, we analyze and interpret, and then we write a report and evaluate our research work, whether it is worth publishing, or is there any kind of like we try to find out that what is the application of the research work, whether it is contributing something to the society, etc., etc., or not. Right. So is this the basic research steps that we have in our research work we need to follow in our research work? Is it so? Hello?
Yes, ma'am.
Okay. Yeah. Yes. Yes.
But certain aspects, sir, madam, when it comes to specifying a purpose for research and reviewing literature, in that aspect, operationally defining the variables is very important, ma'am.
Right. Right. True.
In terms of selection of data, informed consent, confidentiality, and all those aspects are equally important.
True. So while collecting data, that this following certain protocol, that is very important, which also includes that debriefing, informed consent, maintaining the confidentiality of the research work, and whether somebody is willingly participating in a research work. All these things are very important, right? As well as what you said that in that, what was the other thing you said? I'm sorry. Other than this debriefing, this informed consent and all?
Confidentiality.
Operational definition.
Ethical guidelines you need to follow.
That is what it is. All the protocol needs to be followed. So that is for the collecting data. While collecting data, you have to have certain protocols that need to be followed, as well as you said, that operational definitions, because that's true, because defining a particular variable is very important, because that will help us to understand that the direction or the objective of your research work actually, because the same term or same particular concept can be defined in a different way. So we need to also specify that what are we looking at in this particular research, what are we looking at, or what do we mean by attitude, because attitude is a very common word. So now there are different types of attitude, right? It could be maybe antisocial attitude, or maybe pro-social attitude. Even in pro-social attitude, we have altruistic attitude, altruistic behavior. So we need to define that which particular thing that we need to explore in this particular research work. That's true. That's true. So this is the six basic steps will need to be followed, and before at the time of conducting a research work. So today's session will be concentrating on the research design, that experimental research design. right? So here it is the definition of research design, as I already mentioned several times, that a research design is a kind of structure and a strategy of the investigations in order to obtain certain answers to the research questions or a problem, as you already have mentioned, right? It also includes a kind of outline. I mean, it's a kind of blueprint rather. The investigator will do like that the will do from like writing the hypothesis and the operational implication, or maybe like for the final analysis of the data. So basically what I am trying to say, that it is a kind of blueprint of conducting how this entire research work needs to be conducted, right? And that will also guide you. A right research design will also guide you in identifying a particular kind of data that you need to collect, and then data analysis, because this design is also important for data analysis as well as followed by the report writing. So design is the basic thing, the foundation of any research. Okay, can we go ahead? Yes, hello.
Yes, ma'am.
Okay. Okay, so now we'll concentrate on this as per this the syllabi. We concentrate on the topics there in this particular module is that we'll concentrate on that experimental design. Okay, so now that experimental design, as like you have certain idea of experimental design, I guess you all are very learned people. So can you say something on this experimental design? Is any participation from you all? Anyone? Anyone would like to say something on this experimental design?
Ma'am, as name suggests, experimental design. So we want to experiment it and see what would be the outcome. And based on that, we will conclude our study.
Right.
For example, like what we do in chemistry labs.
Mm-hmm.
We have two chemicals. We want to know what will happen if we'll mix them. So we'll experiment it. We'll put one drop of each together, see what happens, whether outburst happens or some new color comes or something. What happens we want to see. So we will experiment and see. So that is same concept is used in this social science also.
Right.
To some extent, we cannot apply this experimental design everywhere, but wherever we can apply it, we will choose those places to experiment and see what happens.
Right.
And
where do we do experiments mainly?
Ma'am, ideally, basic concept of experimental design is concerned with labs, but in social science, all the it started with lab, but all experiments cannot be done in the lab. Sometimes we do it on field work also. We observe it and see. So part of it also happens in field also, ma'am.
Correct. Very good. You have also given an example, very from the basic science. Sometimes we call it applied science. You have given an example of chemistry, which is a basic science, right? And applied science as well. So yes, so that is also a kind of basically that in applied science, basic sciences, the experiments are rigorously there in the lab. Right, all are lab based, but in case of this social science, it could be one part could be in the lab, or maybe some memory experiment, etc., could be on in lab. But then some other, like some natural expression, in order to track some natural expression of a human being, we sometimes do not use this rigorous experimental method, which is is to be conducted in labs. Sometimes we use it other than lab situation as well. So we'll not go into the detail of that. Rather, we'll concentrate on the design part. Right. So yes, so in mainly, what are the different types of group which we have in experimental design? Any idea? I guess you have the idea of this. What are the different types of groups that we need to consider in case of experimental design?
There's
You
an
will get
experiment. Yes, sorry.
Yes. No. You will get the hint from here. That's what I was saying. Yes. Over to you.
Ma'am, there is an experimental group and a control group. We are looking to establish a causal relationship between the variables here while controlling all the other variables.
Right. True. True. Right. So that means as what Swati ma'am, right? Swati ma'am was thinking.
Yes, ma'am.
Yeah. So as per Swati ma'am's understanding, yes, that is very much right, 100% right. That is, we have mainly the two groups. Yeah, I'm not saying that two groups means one experimental group, one control group. I'm not saying that. Okay, so please keep it in mind when I'm saying two types of groups. It is rather we must say that there are two types of groups. Okay, it's not that there would be always two groups. It could be more than two groups as well. Sometimes in some research work, we do not have this control group, but which is actually, is a bit misleading to a few of us. So, and what we are going to, suggest after, in the research work, which is in an experimental design, which is without control group, those type of, that findings would be, bit erroneous. So in general, we have two types of group in experimental design. One is the experimental group, another is the control group. Okay. Do anyone have some idea? I guess you have the idea that, what is known as experimental group and what is known as control group. And if you can give certain example as well in that case. Yes, over to you. Anyone?
Ma'am, the condition would be applied to the experimental group. For example, if you want to see the effect of listening to Carnatic music on say focus, or okay, I don't know how
Attention span.
focus, but
Span of attention.
so
Span of attention.
yes, ma'am. So the experimental group would be the group that would be made to listen to the Carnatic music, and the control group would not be introduced to any music.
Right.
Then
And
the results of the focus of both the groups would be compared.
okay, right, good. So can you tell me, not you, only you, anyone else, those of you have not yet participated or thinking of participating, if you can say that what are the different types of variables that, ma'am has nicely given the explanation of this, of an experiment that can be conducted by having one experimental group, or maybe more than one experimental group, but having an experimental group and a control group. So what are the different variables that we have in this case? Anyone? Is my question clear to all of you?
Yes, ma'am.
Yeah. Yes.
Uh,
Hmm.
can I answer? Yes, ma'am. Ma'am,
Mhm.
there could be extraneous variables that could be
Mhm.
coming to play, like the additional noise in the room.
Ma'am, independent variable and dependent variable.
Correct. Very good. So what is this here? What is the, or if not using the same example, maybe you can say some, like some other example stating in order to identify the independent and dependent variable, which is, also known as IV independent variable, and dependent variable is DV. And ma'am has already given the example that there are something other than IV and DV, something present, maybe the level of noise, if that can be also impacting your span of attention in that particular experiment, which is very relevant variable, but it is impacting or contaminating the relationship between IV and DV. So that what that is known as extraneous variable. So if you have some of your own example, I'm sorry, I'm extremely sorry, some of your own example of identifying IV and DV, or maybe a research work that you have already conducted or you are conducting. Yeah, Varsha ma'am.
Ma'am, a simple example. Suppose we want to study how much pain is being relieved by administering paracetamol.
Right. Okay, good. Very good example.
So
What is this?
So here we have got two things. One is what is paracetamol's effect on
Correct.
headache. Let us consider on headache, reducing headache. So the amount of dose I am administering for paracetamol, that becomes my IV.
Correct. Very good. So that means 1 minute, just 1 minute, Varsha ma'am. Yeah, very good. Nicely explained. Thank you. So yes, it's the dosage, basically what we call dosage, right? So I'm wrong. Dosage would be effect of that dose we are trying to assess on the recovering from how quickly you are going to recover from the fever, or that is what we wanted to study. So the dosage can be varied. So it could be 500, it could be 650, right? This is what you wanted to say?
Yes, ma'am.
Yeah, please go ahead. Very good example. Please go ahead.
So I will experiment. I will begin with let me say 500 dose. I'll administer 500 dose and see how long time it is taking to reduce the headache.
Okay. Right. Done.
This and with one person it will not be. I'll not get good results. What I will do, I'll create 2 groups, 2 or 3 groups. Okay. So with one group, I'll give 500 and see how much time it is taking. With another group, I'll give 650 and see how much time it is taking to reduce the headache. And with the third group, I will give, let me say, 1000 mg and see how much, how far it is seen. And I'll repeat it for maybe, let me say, for 2 and 3 times. Okay, and see how consistent my results are.
Very
so
good.
Based on that, I will say that this is happening there. Okay.
Right.
So I will say 500 is taking.
So that means, and that's please don't mind. I'm just, I like this example so much, and thank you very much that you have given this example. I have never thought of this example. However, this is a very common example. So when I will teach my students, I used to also teach this research design for the PhD scholars and others. So, and also master students. So when I will teach that, I will also give this example. So this is going to be a very interesting example. Okay, please go ahead. I'm sorry, I have just interfered you, but please go ahead.
Yes, ma'am. So with that, what I will find out is, let me say with 500, I have found out that it takes 30 minutes for the headache to reduce. With 650, it is taking 25 minutes. With 1000, it is taking, let me say 15 to 10 minutes. Okay. So, and this result I have seen, it is coming up every time. So I can say that 1000 effect of 1000 is more quickly than effect of 500. So this would be what I would understand.
500 and 650.
Yes.
Right?
Yes.
Maybe. Okay, well, now that which one would be very significantly different, that will maybe this statistical analysis. I hope you know what is the statistical analysis we're going to carry out, F test. So the ANOVA, right? So that will tell us that because there are more than 2 groups. So I talked about ANOVA. If you have 2 groups, so you can go ahead with T test, right?
Yes,
so now forget about the statistical analysis. Let's concentrate on this design. So now that will tell us that which one is more significantly, what should I say, is effective, right? Do you wanted to say this?
Yes.
Right? So this is going to be one very interesting example, interesting research example or research design. Now, as you have rightly pointed out, why? Because I was so excited, I'm telling you, because I, I was about to explain these things as well, that replication is also important in research work. So that is also important, because you said that I have to do it 2 to 3 times, 3, 4, 10 times, right? In order to get whether this similar type of result, if not exactly same, similar type of results are coming out. Right? Yes. Am I correct? We wanted to say this, right? Yes. So this is what is very important. Sometimes when we are using only one experimental group and only one control group, we may not be getting something very authentic. Means what we are going to conclude may not be very authentic. On the other hand, when we are having more than one control group and more than one experimental group, and we are consistently getting that, okay, people who are getting, suppose we can add one more value to this research work, that, like with this 1000 mg, any paracetamol, we are adding one antibiotic.
Yes.
Right? So
yes.
yeah, so it could be another another group, like adding antibiotics. So here it could be like like simple paracetamol versus paracetamol plus antibiotic. So effect of antibiotic can also be determined. So here there would be another type of research work, that is effect of whether there is an effect of antibiotic in in order to getting relief more quickly from fever.
Yes,
right?
Yes, ma'am.
So right, so that is wanted. Very good, excellent. So now one more thing here, what could be the probable extraneous variable, ma'am? Varsha ma'am, or anyone? I mean, I'm not asking her, but she just she already spoken, hence I asked her, but then anybody can, and all of you please kindly contribute, because I will also, I'm getting so much of knowledge from you all. Yeah. Yes. What could be the probable this the what should I say, extraneous variable? Any idea, ma'am?
Ma'am, there could be other drugs also which is being administered to them that can act as extraneous variable. Like, for example, they are getting some brufen something. So brufen has got pain relief effect. So that pain relief also reduces fever also. So this could be an extraneous thing which could show wrong results for our paracetamol study.
Correct. Okay. Anything else? I'm just trying to add. Correct me if you think that something else can be needed. It could be like my what should I say? This immunity. Like the level of immunity that I have.
That also can be there.
That can also be if somebody is going through any kind of terminal disease, they have lower level of immunity.
Yes.
isn't it? If somebody is taking some other, kind of way of getting some healing, like suppose taking vapor, I guess you all know, right?
Yes.
Taking vapor, gargle, salt, like water gargle, right? So that can also be, like a few factors which may play the role of an extraneous variable.
Yes.
Am I making sense here? Very good. So that is, I mean, I think I don't need to teach anything. I mean, I'm not teaching even. I don't need to say anything. You all know everything. So just please help me in understanding better. Okay. So now we will move on. This thing, that means we have in experimental research design, we start with the very basic thing, that is an experimental group or groups and a control group or groups. And then we have this some control over this, some variables, and we are seeing the impact of certain variable or variables on certain variable or variables. So the thing which in being the variables which are being manipulated, like the dosage of paracetamols here in this example can be the dosage is known as, different types of doses are known as different levels of independent variable, and then how quickly I'm going to get relief from my fever or headache, whatever, etc. So my recovery would be the physical recovery kind of. So that is going to be a kind of a dependent variable. And in this relationship, I mean, when like in this particular in addition to these two variables, we have some extraneous variables. There are many extraneous variables. Few of them we need to control. We need to know the strategy of controlling them. And but then again, that is going to be a big session. So how to control the extraneous variables. So we're not going to the detail of that, but we know that there are some extraneous variables known as EVs, right? So with this, we'll move on, right? So, but some experiments may be without control design, but they are erroneous. I'm telling you, they are erroneous because the until and unless you have this extraneous, experimental group, you cannot come up with this firm decision or conclusion, better to say, that a particular treatment is going to have certain effect. So if you do not have this kind of control group, which has not received any kind of extra treatment, then we cannot, what should I say, that we cannot determine the impact of a particular treatment firmly. Right. So, but then this is very basic experimental research design. I will start with the very basic and going to the complex one. So before, after, and you all know before, after, without control group design, right? So I think I no need to tell you all. So if you just read it and give me an example, it would be very much exciting for me. So if that is okay for you all. So if somebody wants to give an example from your day-to-day life, or maybe whatever you have done. Anyone? Anyone would like to say something on this? Anyone? Okay. Okay, so this is the research design. This is an experimental design, which is not very much, like free from limitation. But here we are using only only, like we are not using any kind of control group. So it just as it's the diagram is given, that is that we are, it is pre, post, before and after. So we have certain observation taken before introduction of the treatment, and then treatment is introduced, and then level of again this post treatment, that impact is getting assessed. Okay, so that is what is known as the before after without control group design. And how to find out the impact of this treatment, that is definitely the Y, which is the post treatment one, should be deducted from pre-treatment. Okay, so the example could be like I want to see the impact of certain teaching methods, so maybe audio visual teaching method. So I have selected 50 students from 50 students randomly, and then I introduce this audio visual teaching method on them, and then okay, so I have selected 50 students, I have taken their performance, academic performance, and then that is the pre-test assessment, and then I am introducing the treatment, that is in my audio visual teaching method, and then again post introduction of the treatment, I am again assessing their academic performance, and then I'm trying to find out by subtracting the post academic performance after, that is after introduction of the treatment, subtracted from the pre-introduction of the treatment, their academic performance. So I'm trying to get some effect of the treatment.
Ma'am, can I give another example as well?
Yes. So before that, just 1 minute. Before that, is this what I said is understood? I mean, I have tried to simplify this thing. So you can give definitely your own example. I'm just coming. So is this understood? I mean, yes. Okay. Now, yes, please give the example, please. I wanted to all of you to give the examples, other than I will give the example. Yeah, thank you. Please go ahead.
Ma'am, for any clinical treatment, the active symptomatology needs to be subsided before
Right.
any psychotherapy can be introduced.
Right.
So pre and post, till the active phase is subsided, then and only then the treatment can be introduced. For example, schizophrenia patients, if we want to introduce any kind of rehabilitation perspective, then active symptoms needs to be subsided, and pre and post assessment needs to be conducted, and then and only then therapeutic intervention in terms of rehabilitation can be introduced.
Right. Very good. So that is what like but here in this case, this what I wanted to say, that in this case we do not have any experimental group, and the absence of this experimental group is creating certain difficulty in this particular design. And that is that like when we do not have the control group, the effect of treatment, which is determined on the experimental group only, it is very difficult to say that it is because of this treatment or because of some other effect, because there is no group without introduction of a treatment. So the impact of treatment is like very difficult to be assessed. That is what I'm trying to say. So with this we will go to the next one, where we definitely then we need to I mean, there is a dire need of adding one more control group, sorry, one more experimental group. I'm extremely sorry, adding one more experimental group to the design, right? So here we go, that that is with control group, right? So here before after the similar type of thing, but before after with control group. So we have at least one experimental group, another control group. Acha, let me just tell you, as this diagram has been taken from a trusted source, but then please read this as a test area and control area. Do not read it as like this. So this is an experimental group, this is a control group. So this is my request to please read it as like this. This is an experimental group, this is a control group. right? So now can you tell me what it is? Because this already being discussed. So if somebody else would like to give some other example of their own research work, otherwise this example already, like or on on the recovery, on the health recovery. Okay, so then we are going to divide the total number of participants, suppose say 50. So we are dividing them into two groups, 25 each, right? And then one group would be introduced with an antibiotic. Another group will not be introduced with any antibiotic, a simple, some, like some medicine, not definitely an antibiotic. So then we will assess that whether the group 1 and group 2, which one are going to be getting faster relief from this any kind of disease, maybe fever, etc., etc., and their health recovery, like how quickly they are getting recovered, being recovered, right? So this is could be an before after with control group design, right? So if anybody would like to give some other example, you are free to give that example. Anybody would like to give? Hello? Hello? Am I audible? Hello, am I audible?
Yes, ma'am, you are audible.
Yes. So anybody would like to give some other example from, like which will go with this before after with control group design? Is it understood, or you want to give some other example? Anyone? From your research work that you have conducted or any other thing?
Ma'am,
Yes,
let us talk about standard 9 students. Okay, so if the class consisted of 50 students, so we will divide this 50 students into two halves, 25 and 25. Okay, and we will let us consider English language. So we will take a test of English. Let us start today the experiment. So we will take the test of whole class today. Okay. After that, we will record and keep this data. Then we will introduce to first 25 group of people special training on English language.
Correct.
Okay.
Right.
That will not be given to the control group. And let us plan it out for 1 month. After 1 month, again, we will take the test with both the people.
Right.
Total 50 of them will take. And then we will sort out the data of first group and second group and see with pre-test and post-test whether there was improvement in group 1 is being shown or not.
Right. So that means here the treatment or treatment would be, that is that special training in English that you said, right? Yes. So that is given to the experimental group, and no special training on English. Usual classes are on with the control group, right? And then in the initial time period before the introduction of the treatment, both the groups, nothing was given, and only their English knowledge test was assessed. Right. And then with an experimental group, this English test special training has been given, and then their
We will
experimental
see
groups
how much improvement has come in that.
has there again performance
Yes,
getting
perform.
assessed, and that will that subtracting that second post score, post treatment score from this pre-treatment score here for this experimental group will give you one assessment, right?
Yes,
That whether they are improving or not.
yes, ma'am.
1 minute, sorry. And the control group again, pre-treatment definitely, because they do not have any treatment. So along with an experimental group, we have one basic English performance test, right? And then some basic classes going on, no extra, like English training going on. And then again, their performance being assessed,
Yes.
right? So
Yes.
then we are trying to assess that whether this treatment has certain impact or not,
Yes,
right?
ma'am. Yes, ma'am.
Right. Okay. So that is what the before after control group with control group design, right? Very good. So, but then there is, what is the basic, the basic limitation of this? Is there anyone, because it is already explained, the basic limitation of this, anyone can highlight?
Ma'am, I think so this in this with maturation of time, the person also matures and
Right.
he develops the skill. So that effect we are not considering. That can be an extraneous variable which would affect the study.
Okay, that is okay. And also considering this thing that just 1 minute. Yeah, so considering this thing, just 1 minute. Huh? Okay, considering this thing as well, we have only one experimental group and one control group, right? So there could be by chance those who are, even if you are randomly assigning participants into experimental and control group, but there could be by chance those you are there in the experimental group, they are by chance they are good at English, and
Yes.
by chance who are there in control group, many of them, not all of them, but many of them are not that good much, or not that good in English.
Yes.
So, because we have only one experimental group and only one control group. So in order to avoid that, we can have certain replication, right? So that replication here, that is that we can have many experimental groups, many control groups. And when this, like with many experimental group and many control group, when we are seeing that, okay, similar type of results are seeing or we are getting, right? Then we can easily conclude that, okay, that means, that treatment is going to have certain impact on the experimental group, their performance. So there is a need to increase the number of experimental group as well as this control groups, not only one each. Okay. So, right. Is this understood?
Yes, ma'am.
Okay. So, yeah. So we'll now go ahead with this. Yes.
We should have more number of test groups and control groups. That would give more reliable results.
Yes. More reliable results, more authentic. True. More reliable, because by chance one group, there may be certain particular characteristics. They may have certain characteristics, but if there are many groups, it is very unlikely to have similar type of characteristics for all other groups. It is not possible, ideally, right? So it will automatically minimize this error, experimental error, right? Okay. So we'll move on to, can we move on to the next one?
Yes, ma'am.
Okay, so we'll move on to the another research design, which is completely randomized research design, which I know you all know this, so I no need to tell you very in detail. So this is the this completely randomized design, which I was telling you right now. So when you are randomly assigning experimental group, this already discussed, right? So when we have this random assignment of experiment subjects to be there in the experimental group and to be there in the control group. So what do we mean by random assignment? Anyone? Anyone? Anyone would like to highlight on this? Random assignment, what is the meaning of that? Every
Ma'am,
yes.
suppose a class is there of 50 students
Hmm.
and I am the class teacher.
Hmm.
So I know maximum of my students. So I might choose students who are good enough and put it in one group. Invariably, it might happen because humans have got tendency to do this thing. So my
Okay.
group.
Yeah, I'm just
Complete,
talking.
ma'am.
Yeah, I'm just talking. Yeah, okay. Yes, please.
So what happens that I might choose my best part of the things and I might create groups which are not very good of the things, so that might not give good results. But if I do a randomized things, let me say that out of this 50 students, I know the roll numbers is being given to that. So I'll let me say I'll put it in a bowl, all those roll numbers, and then I'll pick up 25. So my choice is nowhere there. And it is randomly being chosen and the groups are being created. So this will give much better result than what I will choose knowing myself.
Correct. So that means randomization means is that every participant will have the equal opportunity of being selected in the group, right? So it could be like that is the example that you have given, that when you have 50 students in your class and you have to assign them into two group, one is experimental and one control. So in that case you can randomly assign them in experimental and control group in order to minimize any kind of error in the result or the finding that you are going to get. So you are randomly putting them in the group, maybe putting their names in a bowl and then choosing those chits randomly, or maybe using this random number generation table, right? So that is one very important thing that we need to keep it in mind, right? You wanted to say this?
Yes, ma'am.
Yeah. So that is known as two group. As we already mentioned this is known as two group simple randomized design. Okay, so there are two groups, one experimental, another control. But we have already explained that if we have two groups, there may be many kind of errors which may mislead the finding of an experiment. Hence, we need to increase the number of experimental and control groups. Hence, the second type of completely randomized design is CRD. Second type of CRD is known as any idea? Anyone? Yeah, I already explained, so I'm not explaining these things because I have already explained this the demerit of this two groups simple randomized design, and we need to go for multiple or maybe the random replications design. So there should be multiple experimental and multiple control groups, right? Are you all with me? So this could be one possibility which will help you to better deal with this CRD.
Yes, ma'am.
Yes. Okay. So that is this random replication design has certain advantage over this CRD, and which is that as we all know that this more than one experimental and more than one control group will give us more authentic, more reliable, and less chances of committing any kind of experimental error. Okay. Okay. Should I go to the next one?
Yes, ma'am.
Okay, so now there is one more research which is known as randomized block design, which we call it RBD, randomized block design. So, do you have any idea, anyone is having any idea of RBD? And it is actually controlling one extraneous variable, and that is why it is known as that it is taking care of the principle of local control, which is a very important characteristics of an experimental research design. So it is controlling one extraneous variable very effectively, and it has its advantage over other designs so far we have discussed. Right? So anyone is having any kind of, what should I say, a knowledge about this? Anyone? What is RBD? Why are we calling it block?
Because these blocks, they aren't pre-designated under experimental groups or control groups, I think.
No, I'm sorry, I did not get the explanation. What is pre-designated? So no need to use any jargon. No need to use any jargon. No, it's, yeah, sorry, you wanted to say something, just 1 minute. So if you want, initially you can begin with the example that is given here. Then slowly, we can have our own example once you understand this. Anyone can understand the example which is given here. Let me shift this part. It is actually creating certain problem. Oh my God, this cannot be shifted. Yeah.
It is visible to us properly only.
It is not visible.
It's visible, ma'am. Visible.
Visible. Okay.
Form,
Yeah.
form 2, Form 3, Form 4 is given. That table you're talking about. Yes, ma'am.
Sorry, I couldn't get you. Sorry, come again.
Form 1, Form 2, Form 3, Form 4.
No. Yeah. See, I'm telling you. See, think of that these are the Form 1, Form 2, Form 3, Form 4. Don't think is as a form something. Okay, I'm clarifying this thing. So think that these Form 1 se leke Form 4 tak, these 4 are the different types of teaching method. Teaching method 1, teaching method 2, teaching method 3, teaching method 4. Done? Am I making sense?
Yes, ma'am.
Okay. Now you try to tell me if you can understand that why do we need to use this RBD? If you have any questions, I will help you in understanding. Yes.
Ma'am, in this, so our independent variable would be different teaching methods. Form 1, Form 3, Form 4 is there.
Very
Okay.
good. Yes.
And our dependent variable is?
Yes, suppose this 4 different teaching method, these are all our independent variables, right? Different levels of independent variables. And we are assessing the impact of these 4 different levels of independent variables on the student's performance.
Yes.
Right. So student performance would be our dependent variable.
Yes.
Till now it is clear. Achha, now then this is basically what we already discussed. So what is the new thing in their RBG? You can ask me that more than what are your new teaching? Yes. So thing is that when we are saying that when we are assessing the impact of certain IV or IVs on dependent variable or variables, here there are certain factors certain factors which may contaminate this thing. And these are known as extraneous variables, right? So now, here in this particular case, one probable extraneous, very strong extraneous variable could be, which is impacting this entire, relationship. What it could be, maybe the student's IQ. So
Yes.
suppose you are very, not suppose, you all are having a very high IQ, right? So those who are having very high IQ students, those who are having very high IQ, definitely, no matter what type of teaching method do we use, their performance would be more or less very good, isn't it? Now, students who are IQ are very low, suppose, there would be, no matter what type of teaching method do you use, their performance would be not that much good, poor.
Yes.
If it is average, there would be some different trend, no matter what type of teaching method what you are going to use. Right? So that means here, assumption is that this, IQ, the different levels of IQ would be a relevant extraneous variable which may contaminate the relationship, right? Hence, the researcher wanted to control this extraneous variable, which was not an option for the other research methods which we discussed so far, right? So in this method, we are able to control one, I'm telling you very, clearly, one extraneous variable, and that on DV, he has administered one standardized IQ test on the students, and then identified, got their IQ level, and then divide them into groups based on their IQ score, based on their IQ. And they have, he has put student A under a very low IQ, student B low, student C average, high is student D, and very high IQ is student E. Now he has put them in a different blocks. He is not considering them together as a group, because the moment he is going to consider them as a together, he is not going to control this very relevant extraneous variable, which is known as IQ over here. Am I clear to all of you?
Yes, ma'am.
Right? Okay. So now, after categorizing them, or like putting them into different blocks, now he is administering the different teaching method, right, on those, and assessing the different teaching methods impact on the students' performance. But students should be in a different blocks based on their predetermined scores on IQ. Right? Right? Is it clear? Hello? Hello, am I audible to all of you? Hello?
Yes, ma'am, you are audible.
Okay, so that means this method has certain advantage over other methods so far we have discussed, right? What is the advantage? This method is able to control one extraneous variable, as I already said, that the unwanted or uninteresting variable which sorry, uninteresting variable means mainly unwanted, right? Unwanted variable which affect the outcome, which affect the DV. These variables, but then you must keep it in mind that this variable, this extraneous variable should be measured. It should not be something which cannot be measured. Blocking AI reduces the error terms, making your statistical model more predictive and more generalizable. Because otherwise, if we are putting them together and considering those students together who are having very low IQ to very high IQ, considering together as a group, this will lead to certain error, right? Am I clear?
Yes, ma'am.
Okay. Now, this certain disadvantage of this method is that it is, like main to those type of research where we have a very prominent extraneous variable. Because you can take one extraneous variable for blocking, you can take, but then not too many. Because if it is too many blocking, it will actually, being very, very complex. And the number of participants in each one every block would be very less, will lead to no generalizability of research work. Am I clear? So, hello?
Ma'am, please
So
repeat.
we cannot block too many. Yeah, so we are able to block here. The disadvantage is that we are able to, in this particular research, we have to decide which particular extraneous variable we need to choose and block according to that. We have to choose the most relevant extraneous variable. But in many research work, it is difficult to choose only one extraneous variable. Rather, we have many extraneous variables. Am I making this? Hello? Hello? Kindly respond, otherwise it's very difficult for me to understand. Hello? Hello?
Yes, ma'am.
Hello? Yes, yes. Please respond. Otherwise, how will I know that if there is any queries or anything like this? Okay, so that is why this blocking is going to be sometimes, very difficult to use to implement this particular research work, especially in social science, because we have many extraneous variables which are impacting the relationship between IV and DV, impact of IV over DV. Okay, and another thing is that it is very difficult to choose only one extraneous variable which is very much relevant in this particular in social science. Hence, we have some other method which is known as, but which is not there in your syllabus. So I will not, throw some light on that. So if you want to know this thing in detail, maybe in the next class, you can ask me about that particular research work in detail. Maybe I can give you some brief on that. Okay. So in order to choose more than one, in order to choose two, in order to block two extraneous variable in a social science research work, I'm saying in order to block, in order to control two extraneous variables, we have to go for another research work which is known as Latin squared design. Latin squared design, LSD. I repeat, randomized block design is a research work which helps us to control one extraneous variable. When we have more than one extraneous variable, we need to go for Latin square design, which will help us to control 2 extraneous variable, not more than that. Am I making sense?
Yes, ma'am.
Okay, so we'll go to the next one. Okay, so before we go to the next one, the factorial design, right? So I want to give you 5 minutes, that one exercise activity. So if you can just write down the basic, the what should I say, the basic variables included in this research work, and identify which particular research design can be used here. So here we go. Can you write down? Can we write down?
Yes, ma'am.
Okay. So please write down, a researcher wants to, please write down, the researcher wants to determine the impact of 4 different types of teaching methods, 4 different types of teaching methods in enhancing memory. Is it okay? Have you written?
Yes, ma'am.
Right? Okay. But he has found that in this particular research work, the age could be one extraneous variable. The age could be one extraneous variable. Which method of which research design are you going to use? Is it okay?
Yes, ma'am.
Okay. So just 5 minutes, you don't need to write down many things. You just write down that which method, research design, we can use it, and just tell me how, very briefly, just 2 to 3 minutes you can take it, and you can come up with your answer. I think this is very easy to understand. So I think you understand what I'm trying to say. Just now we have discussed, so you can come up with the right one, I think. Right? Is it okay? Hello?
Yes, ma'am.
Yeah. So just 2 to 3 minutes we can have. We can come back at 9. Now it is 9:33. So we can come back at 9:35 or not max 36. Okay? Okay?
Yes, ma'am.
Yeah. Over to you all. Yes. Are we done? Hello? Hello, are we done?
Yes, ma'am.
Okay. So what is the answer? If you can explain it to me. Quickly. Yes, yes, I'm there. Yeah, I'm there. Farah, if you have anything to ask, or,
Oh,
I
yeah.
mean,
No, ma'am. I was just asking whether you're there.
no, 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 I'm there. Maybe I was responding, but there was a network issue, so you couldn't hear me. Maybe, I don't know. Okay. Yeah. Yes. Can anyone quickly discuss? Because we need to explain this factorial design as well. Can anyone? Hello? Hello?
Okay, Swati. Swati, Varsha, Mona Lisa, do you want to try
They
about
can,
this?
I guess.
You can make mistake also. Ma'am is there to guide you.
I think without further wasting time, in
Yeah.
this particular work, in this particular design, we have used this, the randomized block design, right? Because I said that impact of 4 different, types of method on improving memory. So impact of those methods would be different, I mean, different levels of IV, right? And then improving memory would be improvement would be, that memory would be this dependent variable. And then when the researcher has found that the age would be a very relevant extraneous variable, because with age sometimes, for an old age people, the memory decline, like it declines, memory declines over age. So that researcher can block the participants based on their age. So based on his understanding that he can put a certain bracket of age, like in a particular block, and then like he can administer the different different levels of a particular independent variable on different age group of people. Age has already been considered as a blocking variable, and then he can see that improvement of which particular age group of people is more vis-a-vis somebody's, for a particular age group the improvement is very less, or for some particular age group there is no improvement at all. So that is going to be an RBD, this RBD, research randomized block design. Am I making sense to all of you? I
Yes,
think we need to respond. Yeah, yeah. Okay. So now we will move on to the next design, which that is known as a factorial research design. Okay. So factorial research design, when we are actually till now, what we said that we are we are using that one particular independent variable, its impact on a particular dependent variable. Right now, we were seeing that impact of a particular independent variable on a dependent variable. Now, that independent variable may have different levels. I said several times that independent variable may have different levels. So maybe it is an, the impact of antibiotic. So different level of antibiotic. So very strong antibiotic, mild antibiotic, very mild antibiotic, etc., etc. But ultimately, the independent variable, there was one independent variable and there was one dependent variable. So that obvious question comes that when we have more than one independent variable, so if it is, more, when we have more than one independent variable, then we use factorial design. And not only that, in factorial design, we are going to assess the impact of the main effect as well as the interaction effect. I repeat, in factorial design, as we have more than one independent variable, we can assess the main effect of those particular independent variables as well as their interaction effect of that particular variable, of those particular variables, right? Am I making sense?
Yes, ma'am.
Okay, so for example, here we can add one more variable to this particular existing example, like with antibiotic and the level of immunity. So now we are having two independent variable. One is the different types of antibiotic and the different immunity level. So very high, suppose we have two variations. Suppose we have two variables, now two independent variable. One is immunity level, another is antibiotic. Now in immunity, the first independent variable, we have two levels of that variable, right? So immunity is very high, immunity is very low. For example, now for another independent variable 2, which is the antibiotic, we can have two variations of that. That it could be very high dosage of antibiotic, very low dosage of antibiotic, and then we can see the impact of these two independent variables on the recovery, the rate of recovery of a patient or a group of patient, right? So this is known as factorial design, because we have more than one independent variables. And we are also assessing not only the main effect, but also the interaction effect. Okay. Now, as I said in the previous design, that two independent variables having two variations each. Am I making sense to all of you? Kindly respond, because
Yes,
otherwise I will not be able to. Yeah. So two independent variables. I think you can also see me. I have switched on my video. There are two independent variables. Please write down if you have some problem in understanding. Two independent variables. Independent variable 1 having two different levels, and independent variable 2 also having two different levels. This type of research, this type of factorial design is known as simple factorial design, and that too even 2 by 2 simple factorial design. Why it is 2 by 2? Because in simple factorial design, we have two independent variables. It is known as two-factor factorial design. In simple factorial design, we have two independent variables, and then two independent variables. In this particular example that I gave, that two levels of first independent variable, again two levels of second independent variable. So that is why it is known as 2 by 2 simple factorial design. Is it clear?
Yes, ma'am.
Okay, so this is the graphical representation of this. So this is what it is, right? The concept of factorial design. So here we are seeing the impact of independent variable 1 on dependent variable, that is the recovery rate, as well as in main effect of independent variable 2 on the recovery rate, which is a dependent variable, as well as the interaction effect of independent variable 1 and 2 on the recovery rate of the patient, right? How the interaction is going to be assessed? Like suppose we have two variations of each, two levels of each, right? Two levels of each one of this independent variable. So here you can see, if you can see my cursor, so at this particular, what is the, the recovery rate over here when level 1 of IV1, level 1 of IV2? What is the recovery one when it is level 1 of level 1 of IV1, level 2 is of IV2? Similar thing is that here also level 2 of IV1, level 1 of IV2. Here level 2 of both the IVs. So this fine tuning means this interaction effect is available in factorial research and which is widely used in social science. Am I making sense?
Yes, ma'am.
Okay, so now it not necessarily it is always going to have two levels of each independent variable. Independent variables should be two in simple factorial design, but the levels could be anything. Suppose I'm adding, if you see my cursor, I'm adding for independent variable 1, I'm adding one more level. That means independent variable 1 is having 3 levels, for example, and independent variable 2 is having 2 levels as it is, right? So what would be this type of factorial design? This is simple factorial design because there are 2 independent variables, but it is going to be 3 by 2 independent variable. Am I making sense to you all?
Yes, ma'am.
Okay, why it is 3? Because 3 levels of IV1, that is why it is 3, by means into will not say, we will say by, and then 2 levels of independent variable 2. That is why it is 3 by 2 simple factorial design. Is that clear?
Yes, ma'am.
Okay, so will you be able to now sketch any other different type of simple factorial design? Like it could be 3 by 4, it could be 4 by 4, right?
Yes, ma'am.
So what this could be? Just suppose if it is 3 by 4, what would be the first independent variable levels? How
3
many?
levels in
3
IV1
levels
and 4 in
one.
IV2.
Excellent, excellent. Okay, so now we will move on to the complex factorial design. So which is an value addition over the simple factorial design, right? So the question may be asked that if there are more than 2 independent variables, then what will happen, right? So if there are more than 2 independent variables, the concept remains same, but we are using complex factorial design. And that means here you can see that this is an example of complex factorial design. Here you can see the psychotherapy type. There are two variations. Psychotherapy type is one independent variable. Suppose, for example, this is IV1. Okay, for the time being, I'm saying IV. Okay, so psychotherapy type is IV1. It has 2 levels, cognitive and behavioral. Clear?
Yes, ma'am.
Clear? Okay. Second independent variable is length, which has also two variations, 2 levels, that is 2 months or 2 weeks. That is second independent variable. And the third independent variable, the gender of therapist. Here, the therapist, male or female. That is also, this is third independent variable, and there are 2 variations, male or female. So what type of complex factorial design it is going to be? 2 by 2 by 2 complex factorial design. Why it is complex? Because it has more than 2 independent variables. I repeat, it has more than 2 independent variables, right? It could be 3 or more than that. The more it is going to be number of independent variables you are going to add, it is going to be very much complex. And here we have 2 levels of each one of these independent variables. Hence, it is known as 2 by 2 by 2. So if suppose this psychotherapy, okay, so this length could be, suppose, tell me, psychotherapy 2 levels, psychotherapy IV1 2 levels, length instead of 2 levels, if we are adding 3 levels, the therapist gender remains same. So what this could be? How will you term it?
2 into 3 into 2 factorial design.
Sorry, 2 by 3 by 2
I think so.
factorial design. Yeah, 2 by 3 by 2 factorial, complex factorial design. Please mention complex factorial design. And it is complex and it is more authentic, right? Because it is actually giving you the fine tuning of this interaction effect. So it will tell you whether this cognitive therapy or behavioral therapy is more effective, whether this 2 months length is effective or 2 weeks effective length is effective. So the primary, the main effect of length, the main effect of psychotherapy, the main effect of gender of therapies, as well as this interaction effect. That means if the psychotherapy type is cognitive, therapist is female, and the length is 2 months. So it will give you a kind of interaction effect as well. And it will give you a fine tuning. It will help you in fine tuning your research work and give you a more authentic, the results. Right? Am I clear?
Yes, ma'am.
Okay. So we'll move on. That means this is the one of the best method that we, like we can use in our social science, and we can add some, like more variations, and we can also see their primary effect, main effect, as well as the interaction effect in this factorial research design. Simple factorial research design, considering 2 independent variables. Complex factorial research design, considering more than 2 independent variables. It could be 3 or it could be any number. Okay, so there are different types of interaction, as I was giving more emphasis on this interaction. So one is antagonistic interaction. That is the main effect. Sometimes we can see main effect is not significant, but interaction effect is significant. So this you will get after calculating your data, right? So this will be more for the statistical analysis. So sometimes this main effect of, suppose psychotherapy, main effects are not significant, but interaction effect, the way I said, it is significant. Synergistic interaction is that sometimes the higher level of some independent variable, it also enhances the another level of another independent variable. That means if suppose for example, this dosage, right? So the example of high dosage of antibiotic and having high what should I say, that the high level of immunity, which will have the very significant effect. Are you getting my point? So high dosage of antibiotic as well as high level of immunity is going to be very significant, right?
Yes, ma'am.
Okay, and then ceiling effect interaction is that higher level of one independent variable reduces the effect of another variable. Okay, so it could be like sometimes you can see that even if somebody is not getting this higher levels of, even if when somebody is having very high level of immunity, even if they are getting very low, dosage of antibiotic, their recovery rate is going to be very high because immunity matters. Am I making sense to you all? So higher level of immunity, if I have, then even if I'm getting a very lower dosage of this thing, the antibiotic, I can also get recovery quickly. Am I making that? Hello?
Yes, ma'am.
Okay. Yeah. So now we will move on to the another thing, that is segment, which is the cross-sectional and longitudinal study. Okay. That is also one type of research design in our research design, right? So do you have any idea of this cross-sectional and longitudinal study? Do anyone is having any idea? Can you get any idea from this? Let me tell you without wasting further time. So in cross-sectional study, it is, like at a single point of time, you are studying a different groups. For example, right now I am administering an IQ test on one group of male, another group of female. Right? So at a single point of time, I am administering a particular test on a different group of participants. So male and female, two different group of participants. I am administering my IQ test right now on both of them. This is cross-sectional. And longitudinal is that I am considering a group of male students, for example, a group of students. Like suppose this is the group. I am considering this group and I am studying them over time. So now I am studying their performance right now. I will study their performance after every 6 months. So the same group is being studied over time. I repeat, the same group is being studied over time. So this is known as longitudinal study. Okay, in cross-sectional study, we are studying different groups at a single point of time. The example that I gave. In a longitudinal study, I am studying a particular group, the same group of subjects being studied over time. So suppose I am studying 40 to 50 range people aged between 40 to 50. I'm studying their memory capability. 50 participants. I'm studying the same group when that group will be, they will be after 10 years, what would be their memory retention, the retention capability. Again, after 10 years, what would be their retention capability? The same group is being studied over time, right? Is this any query?
No, ma'am.
Okay. So let us just go ahead. This is like cross-sectional studies are very quick, as I said, compared to longitudinal study. Longitudinal study is very time consuming. So this is the, like the pros and cons of both. Cross-sectional studies at a single point of time, it is over time. Cross-sectional conducted with the different samples, longitudinal with the same group of sample over time. Cross-sectional cannot put any cause and effect relationship because I am at a single point of time, I am studying all the different groups. So you cannot say that this will definitely lead to this particular effect. This cause is an effect of this. Okay. But in longitudinal, you can justify this cause and effect because you are studying the same group. You can see their memory retention in every 10 years. So you can see that, okay, over time, their memory is declining. Over time, this is growing high, for example. So you can see this is a cause and effect. You can establish there is a cause and effect. Okay. Cross-sectional is a cheaper, longitudinal is a bit expensive with respect to time and money. Okay. So let's go to this ex post facto research design. The ex post facto research design is something which we sometimes, many a times we use in psychology, that is known as when the researcher simply predicts the probable cause behind certain effect, but the effect has already been occurred. I repeat, researcher is predicting some possible causes behind a certain effect, the effect which has already been occurred, right? So suppose a child has become a delinquent, already is being indulged in different criminal activities because of this environment, etc., etc. Now, the researcher is simply studying that what are the probable factors behind his delinquent behavior. So he may find that lack of discipline at work, in school, in the family, maybe family history, some peer pressure, maybe the neighborhood, the environment, the socialization, etc., etc., could be responsible for this, for his delinquent behavior. But delinquent behavior has already taken place. And that is why it is known as ex post facto research. The effect has already been occurred. You are simply trying to find out the probable causes behind that, right? You as a researcher do not have any control over any kind of variables because this effect has already taken place. You are simply assessing those probable factors which may be behind a certain behavior which has already been occurred. So somebody is a patient of a cancer. Now you are studying what was his previous life, what was his life history, what happened, what are the other factors, maybe eating habits, etc., etc., maybe the stress level, what he had. But cancer has already taken place. Cancer has occurred. So you do not have any kind of control over that. So you are simply assessing the probable causes. So there are different, these are the characteristics I've already mentioned. So these are the basic differences between experimental and ex post facto research. I already explained with an example that ex post facto research, not like experimental research, because in experimental research, you are finding the impact of IV or IVs on DV. Ex post facto is something which you do not have any direct control. You cannot manipulate anything. You are simply finding out the probable cause behind certain, cause behind certain, effect. Okay, so what causes cancer? But cancer has already taken place. Okay, so the strength of ex post factors, it is very much relevant in, as I said, in social science research, etc., etc. It is less time consuming. You don't need to manipulate anything. You don't need to control any variables. You don't need to even go for any kind of specific research design like RBD, etc., etc. But it has many weaknesses. The main foremost important weakness is it cannot manipulate any kind of variable. It just simply assess the probable factors behind certain things. Okay, and the last part, which is very simple, that is case control study. Case control study is a study where it compares, like suppose a patient is similar to, this is ex post factor, similar, as I said, but there is one control group. There is one control group. That is why it is known as case control study. So the case is that, suppose you have two group of patient, one group, the patient group, group one, known as case, they have certain disease, right? Another group, known as control group, they do not have certain disease. Disease has already taken place for case, group one. Disease has not taken place for group two, which is known as control. Now you are assessing different risk factors which was exposed to each one of this group, and you are trying to assess certain factors that maybe the case group, the group one, had certain risk factors in their life, and that is why they are exposed to certain things, and that is why they have certain disease. And the control group, who did not have any kind of factors, risk factors, did not have any exposure to the risk factors, and that is why they do not have certain disease. And you are simply doing a kind of retrospective analysis. Retrospective means going back. That means you have two groups. One is a case having certain disease. Another is a group doesn't have certain disease. And now you are assessing their risk factors, right? The one difference with this ex post factor is that in this case, there is two groups. One is case, another is control. There is, which was not there in ex post facto research design. This case control group research design is known as retrospective studies. It has certain advantages, like it is very much applicable for studying certain, especially in medical science, studying certain rare diseases, vis-a-vis the group which they do not have. It also can give you certain comparison that between the group who has a certain disease vis-a-vis the group who doesn't have a certain disease. Less time needed, initially you can have certain assumption, the risk factors exposed to the group 1, here group 1, who are the case, who are known as case, and the risk factor not exposed to group 2, who are known as control group. Disadvantage is that it is all about retrospective study and not at all very much, cannot be used in diagnosing something, and it is very difficult to sometimes find out a control group. So somebody, a particular group of patient having a very rare type of cancer, then another control group, it is very difficult to get. Hence, this study is not widely applicable, but it is mostly applicable in medical science. Okay. With this, let me just, finish it. These are the example I have already given. So if you want, you can go through it. This is what it is. So can anyone quickly give me a, brief of what we discussed so far in this particular session? Just a brief of all those things that we discussed. I'm just stopping my sharing. Yeah. Over to you. So can anyone quickly tell me what we discussed so far? Just the topics.
We talked
Hello?
about
Yes.
qualitative research designs.
Right.
Under that, we have started with experimental design. In
Correct.
experimental design, we studied pre and post test without control group, then pre and post test with control group.
Right.
Then complete randomized designs we talked about. Under complete randomized design, we have got random replication design, then
Very good.
randomized block design, and then lattice square design.
The lattice square design, it is not there in your syllabus, so I did not discuss it. So when the handout I will provide, I will give a brief of that. Okay, so it is not included in your syllabus, but I just discussed it in the context that in randomized block design, you can control one extraneous variable, and in lattice square design, you can control two extraneous variable and have certain advantage over randomized block design. That's what I said. Very good. Go ahead.
Then factorial research design we discussed. Under factorial research design, we have got two: simple factorial design and complex factorial design. Now, simple factorial design, depending on number of the levels of each IV, we can have
different types of factorial design. So simple means we have two independent variables. Complex means we have more than two. Right, independent variables, and the levels will determine that the different, whether it is going to be 2 by 2, whether it is going to be 3 by 2, 3 by 4, 3 by 10, etc., etc. Right, very good.
Then,
Next.
Then we talked about what all things we can, what is the advantage of having factorial design. We like factorial design, we can study primary effect, main effect, and interactional effect. Under interactional effects, we have studied antagonistic interactional effect, then synergistic interactional effect, and ceiling effect. We have
Very good.
Then cross-sectional study and longitudinal study we have studied.
Right.
And then post facto research design and case control design.
Right. Excellent. Excellent. Big hands for all of you. And let me tell you just one thing, last one, that then it's over to sir. When it is that you will be given certain, in any kind of exam, you will be appearing for any kind of exam, right? So, right now. So any kind of exam, if it is given, the question is a critical discussion of a particular design or etc. etc. So please write in critical discussion, write both the pros and cons, the advantages and disadvantages, everything we have discussed in detail with so much of examples. Please write both when it is critical discussion. Am I making sense?
Yes, ma'am.
Okay, thank you. Big hands to all of you. Thank you very much for participating. Thank you very much for your patient hearing. And I have learned so many things from you. I'm really excited. Thank you. Over to you.
Thank
sir.
you, ma'am.
Thank you.
Okay, thank you, Professor Rita Karmokar. Very nice the discussion you have covered, both the true and the quasi-experimental design. Both things you have covered. I think all my students, they have understood what you have disseminated. I hope that is particularly in case of the problem-solving situation, they will apply the experimental design in their research. So I am thankful again to you and
That is
all
my
my students, and they are very sincere. They have taken the notes and
Yes.
whatever your suggestions they have followed. I hope that is in future when you evaluate their performance, you will get very good result from them.
Yes.
Okay, thank you.
Thank you, sir. Pranam, sir.
Thank you.
Sir, may I
So
leave?
now
now?
I am closing.